Cancer and chemotherapy. What is cancer? Cancer is abnormal growth of cells in number, shape, size, and function. Cancer is a group of disease that can cause any sign and symptoms that will depend on where the cancer is and how much it affects the organ or tissues. If the cancer had spread, metastasized, signs or symptoms may appear in different parts of the body. A cancer may cause symptoms like fever, fatigue, and weight loss. The most common cancer diseases in Saudi Arabia: colorectal cancer in male, breast cancer in female, lung cancer for both, leukemia among children. The incidence rate. Cancer treatment modalities are chemotherapy, surgery, radiation, and others. How does the chemo work? Chemo is used to shrink the tumors and or stop the cancer from growing and spreading. But the cancer is going to kill the abnormal and normal cells. The affected normal cells are bone marrow, hair, and skin cells. Low RBCs is anemia, but white BCs is neutropenia. Low platelet is thrombocytopenia that affect the bone marrow cells. If all of them are affected, we call this case pancytopenia. Something you're gonna hear it for the first time. ANC, absolute neutrophil count, the real number of white blood cells that are neutrophil. The absolute neutrophil count is commonly called the ANC. It's found by multiplying the white BC's count by the percent of neutrophil in the blood. GCSF is given as injection. This treatment is used to help the body to produce more white blood cells. The nadir period. In cancer treatment, nadir refers to the lowest point that an individual blood cell count will reach as a side effect of chemotherapy or radiation therapy. The nadir for each blood cell type occur at different times, and for white BCs and platelets normally occurs around day 7 to 14 following the last day of treatment. RBCs which live longer will typically not reach a nadir for several weeks. Antiemetic is a medication administered to patients to prevent nausea and vomiting as a side effect of chemotherapy. Nursing rule: review patient CBC with differential and electrolyte. Monitoring patient vital signs. Monitoring patient CNS function. Monitoring patient liver function. And also patient diet, low bacterial diet. Education. The immune system is weak during the nadir period. Patients are advised to avoid situations that can lead to increased risk of infection. If patient develop fever, should not take paracetamol or any other medication. Directly go to ER. Patient should keep his or her body hydrated and moisture. Patient should eat food that are cleaned and cooked very well. Avoid uncooked food such as sushi. At the end, we have some questions for you. Be ready.
Created using Powtoon.